morning, everyone, and welcome to the Telemedicine Echo. My name is Beth Munson, and I am the coordinator for this Echo. I work for Missouri Telehealth Network and Show Me Echo at the University of Missouri in Columbia. I am now going to turn this over to our facilitator today, Molly Brown, and she's going to get us started. Hi, Molly, how are you today?
Good morning, everybody. I'm doing well, thank you. So I want to welcome everyone to the Telehealth Echo this morning. My name is Molly Brown, and I'm from the Heartland Telehealth Resource Center. We're glad you're joining us for this Telemedicine Echo series created by the HTRC and the Missouri Telehealth Network. As we begin today, just a few things to keep in mind. This session is being recorded, and we will share it with you afterwards. Your microphones have been muted when you entered the Zoom, so please unmute or use the chat to talk if you have any questions. You can test out the chat by typing your name and organization so we know who's here and who's joining us today. We appreciate you keeping your camera on so it feels like we're talking to people instead of blank screens. You'll be sent surveys after each session to complete with your team. We appreciate you filling them out to help us know what to address. So let's get started. I'd like to introduce Robert Stiles. He is the Program Director for the Telehealth ROCKS Program, and he also does policy work for the Heartland Telehealth Resource Center. He's here today to talk about community engagement. Welcome, Robert.
Sure, if I can get myself unmuted. Good morning to everyone. I know many of you have seen me talk ad nauseum sometimes, especially early on in COVID about policy. But I actually have another job. I'm the program director with a couple of different HRSA grants as well as the SAMHSA grant that are all focused on local communities and community engagement. So gonna go ahead and share my screen. If I can get this up. You'd think after 3 years of COVID or however long it's been, it seems like forever, I'd be better at getting PowerPoints up on Zoom meetings. So wanted to start by kind of explaining where this presentation comes from. I was really fortunate last fall to be asked by the National Rural Health Resource Center to present a PowerPoint or a presentation at a conference they were having on partnership and communities. And because I had some time, and also because I think it's very hard, the key of being a partner is knowing your partners and listening to your partners. So I took that opportunity to basically go back over 20 years of my career and ask the people that I partnered with what made a good partner. And, this sort of, why did you like working with me? Or, well, maybe hate working with me, but, really getting at what was important to partnership. And so what we're going to see today is we're going to talk about patient engagement as well a little bit. But we'll see that whether it's working in your local community, working at the state level, and even working with national partners, what people came up with is pretty much the same. So talking about my current work that involves a lot of partnership, I work with what's called Telehealth ROCKS. I'm the program director there. And our goal is that every child has the exact same opportunity for success in school and in life. So we focus on school districts and local communities. We work in South Central Kansas as well as Southeast Kansas. And one of the things that we work on is we have a grant that's looking at a patient-centered consumer-directed healthcare. It's called Evidence-Based Telehealth Network Program that focuses on social determinants of health and really looks at how do we work to change communities and use community health workers in schools with that. So in addition, we have a longer grant that we've received from SAMHSA that really focuses on communities that have had declared disasters and recovery from that and the trauma in children. Another school-based program, so really working on sort of what I call the background trauma, which is social determinants of health, as well as impact of direct events on communities and children. And then in addition, we have a pretty long history of doing school-focused and community-focused echoes and other telementoring and training series. So overall, we work really hard to be good partners in the local community, not only with local healthcare providers and to have them as part of our grants, but also with school districts and even with individuals in the community that are sort of the end receiver of the services, our patients. So we use a public health approach And the idea is that we're going to change the upstream conditions while at the same time focusing on those needs that are prevalent and apparent, especially as we're looking at COVID and everything that's going on with children related to COVID, as well as just sort of everything going on in the environment, whether it's the Russian invasion of the Ukraine or gas prices or just some of the uncertainty that's going on. So we're really, when we talk about partner engagement, we have to think about telehealth being made up of both the organization, the provider, and the consumer, right? So you have the entity providing telehealth services, whether that's KU Health System with some of the grants that we have, as well as local partners, like we work with the Federally Qualified Health Center in Southeast Kansas, the provider, right? And so we spent a lot of time last month, and I really appreciate the presentation that we had on engaging the providers and making them part of the process and the team and getting that buy-in. And then the consumer or the patient, right? Patients have to want telehealth services. They have to see that as the best way to meet their needs. And to be honest, telehealth services have to meet their needs for patients to want to use them or to use them. So like I said, last month, we talked about how to engage with providers. When we talk about consumer engagement, we talk about patients, engaging patients in their homes, in their community, getting care where it's needed in the community is what it's all about. And that's one reason why telehealth is such a vital thing, whether that's a specialty service so that someone doesn't have to travel long distances, or it's some type of making it possible to get telehealth with busy schedules and jobs that don't let you leave, or get services into a school district so they can be partnered alongside the work of the school's doing, right? With the child, school is the environment where the child is 8 hours a day. And when you get parents and children and schools together working on issues and needs, you can really have a lot more impact on a child. So, this really telehealth is part of the real drive, whether it's hospitals or local communities, to think about the right patient, the person who needs the care, the right time, when they need it, in the right place. And telehealth allows that to occur in lots of different locations. So, telehealth may be new to consumers and to patients, maybe new to local community groups, and it may be seen as a threat sometimes in the local community when you have other healthcare providers. So helping to be a good partner and understand the needs of the community and be part of the community is important. And you really have to think about, how do I inform and engage them so they understand what telehealth is and how to use it. And then really getting at defining success, what are the most important, and you have to identify for building and developing a successful program. And I would say strong community partnerships, strong patient buy-in are really going to be the most important things. So when we talk about partnering, right, why can't we just do it all alone? It gets back to this idea that no person, community, or healthcare entity is an island. You can't do it alone, right? We can't really meet a community, so we need to be part of a community if we're just trying to do it all on our own. And also, when I'm a public health guy, health outcomes require a focus on the whole person and the community. You can't say, I'm going to get this primary care or this specialty care in a vacuum and we'll fix the patient, right? You have to have all kinds of other approaches. And that's why even in the work that we're doing with children, the pediatric side of behavioral health, and with school districts, we're looking at social determinants and the home environment and all of these other things, because they absolutely are important to a person being healthy and having a true definition of health. And finally, if you involve others, you engage others. When you talk about partnership, when you talk about community engagement, say, why isn't my telehealth program successful? You might not have engaged at the level you need to for people to really understand why it's beneficial, why it's needed, and why they want to participate. So in that community buy-in is also very important. So after all the conversations I had, and we'll see in a minute, we'll go through what some of the people said. And if you're wondering why the rabbits are here, I can tell you it's because of Easter. But the truth of it is that I tend to ramble. Any of you who've worked with me in the past know that. And my mom, good Baptist woman, used to hate it when we had a guest preacher who chased rabbits, right? She wanted you to get to the point, have a nice sermon, and get home because she wanted Sunday dinner. And so we'll chase some rabbits today, but we're going to keep coming back to these core concepts. So one thing that's crucial that I heard over and over is trust. You have to have respect. You have to treat your partners equally, right? It's equality. You're doing this together. You have to be prepared. You have to know each other. You have to collaborate, and it has to be true collaboration. It's not, I have an answer and you need to make use of it. You need to accept my services. You need to let me into your community and take over everything, right? Communication. in everything we do in life, often when it goes wrong, it's because we didn't communicate, and we didn't communicate well, and we didn't have strong communication. I found that throughout my career, when I've had things not go well, I can almost always go back to communication and see where the issue came. And then you have to have shared vision and goals, right? You can't have a partner and you can't work on these issues. And what's interesting is these same concepts work at the national level, they work at the state level, they work with your community partners, and they work with your patients. If you push for these 5 things and you keep them in mind, I can promise you, you will have strong partnerships and you will have strong buy-in. So really thinking about who on this other side of, we talk about the partners of the Telehealth Resource Center, Heartland Telehealth Resource Center, but talking about sort of in this local community, very locally community engaged work that we have. Right now, we partner with the South Central Kansas Special Education Cooperative with our work. Community Health Center Southeast Kansas, one of the largest FQHC in Kansas and one of the larger rural FQHCs in the country. I just heard that they were the 18th largest. Fern Valley in Springfield, Missouri is the 12th largest. So, we do have some very large rural FQHCs in our states. We partner with Coffeyville USD 445 School District. We have telebehavioral in the know. And then we've worked alongside Fort County Mental Health Center, which is in that area. And then it's very interesting, Eldon, Missouri School District has some of the most substantial work I've seen on social determinants. And so I worked with them when I was in Missouri before and continue to work with them. I'm pretty excited about that. We're currently writing a grant to SAMHSA that would continue this work that we're doing. And so over the last 2 weeks, I've spent all my time, or a very large chunk of it, of my time on the phone, working with and partnering with and thinking about and talking with these new potential partners about how does what we're proposing doing, as well as what they would like to do, how do they align? How can we work together? And so bringing in the Kansas Department of Aging and Disability Services, bringing in the Kansas Department of Education, Greenbush Education Service Center, which is a very large local education agency that provides lots of different things in Southeast Kansas and across the state. DECA, which is a very strong substance use program out of Lawrence, Kansas, headquarters prevention, suicide prevention, which is the main suicide prevention work agency in the state of Kansas, including having a suicide hotline. So, not only do I have sort of long existing partners, many of these guys, Coffeyville School District, I started working with in 2011, Community Health Center Southeast Kansas, started working with in 2001, Fort County Mental Health Center, 2011, Eldon, Missouri School District, 2015. But also, bringing in new partners and having to kind of relive the things that are important to having strong partnerships as you start out with some new partners that you're introducing yourself to. So talking about local partnership, Aaron Brinson from the Eldon School District. And we're not going to go through all of this. The slides will be sent out, but I always like to really, especially if I'm saying this is what this person said, I want to give you the background, but we'll hit the stuff that's in dark red more. So Aaron, who is the Director of Special Services, that was one of the people I went to way back in 2015 and said, hey, what do you think about putting a community health worker in schools? Which was a new idea. No one was really doing or thinking about. And why would a community health worker belong in a school when schools are about education? He says that one of the things is you got to know your area, right? You've got to understand where you're providing services, what the issues are going to be. And even, he brings up what toes are you stepping on? Trust. You got to trust in each other and you got to know why you're doing this. And that partnership has to be a cornerstone of your practice, that communication, that conversation, that understanding what their needs are and your needs are, and listening. When we got these new HRSA grants last September, we got the training grant as well as the evidence-based grant. One of the first things I did was go down to Coffeyville School District, which is one of our partners for the Community Health Center of Southeast Kansas. Went through the grant with them, right? Because it had been many months since we applied, and they'd said, yeah, we want to do this. And said, okay, now here's what the grant requires us to accomplish. Now what do you need? And understanding that conversation as we were getting things kicked off was crucial, because we had to understand, yes, we all agreed we would meet these goals for HRSA, but we really needed to revisit and talk about how to make it practical in a way that worked for everyone. Roxy Anders with South Central Kansas Special Education Cooperative. Understand what resources are needed at the local level that can help with the needs of the community, open communication, as we've seen again. She brings up the need for services. And there is nothing wrong with getting funding. I'm great at getting funding. We have, over my career, I've gotten substantial HRSA funding, SAMHSA funding, and we'll talk a little bit about where to get funding from some of this work. As long as you're moving the line and you have a line and you know where you're going, and you know, I always say, 5 goals, 5 things you want to do, 5 needs you identify. You may not be able to meet them right now, but as new opportunities come along, whether that's in partnership or in funding, they should always be able to place the next steps. You should know where your next steps are. You should know where you're going. And if you do that, there's nothing wrong. And it's absolutely incredibly beneficial to go get grant funding to fund the startup of those activities and get them going with an understanding of what the sustainability is over time. So talking about Coffeyville School District, where this Telehealth ROCKS has actually worked since 2017. And I used to live in Coffeyville. I started in school clinics in that district. I've worked with them since 2011. When she talks about local partnership, it's the same thing. What's the unmet need? Time and time again, you've got to understand your community. You've got to do needs assessments. You've got to think about these things. The ability to access what you need, and the ease of being able to get it where you're located. Being resourceful, working well together, listening to each other, those types of things are important. Just a couple more as we think about local partnership. Les Lacey, who I've worked with, since back to the early 2000s when I was with the state of Kansas as the primary care director, said, understand your area, right? Many larger places don't understand we're as small as we are and what that means. I may think that something's important, or I may want to do it as the sort of big dog KU med, but it may not be important to that local community. You put a service into the local community that they don't feel like they need or want, or they feel like the need is already met, you're going to wonder why it fails. And it's because you didn't provide anything that was needed. Understand the geographic scale of things, the infrastructure, really get to know that community. And then Chris Grund, who is with Grady County Health Services, way out on the border, Colorado, Kansas, multidisciplinary. She's really a big fan of kind of bringing in everybody across the community. It's amazing. I mean, one of the things that I've spent a lot of time on is this idea that we as behavioral health providers, as clinicians, and school districts are doing the same things with kids, and we're talking about the same things, and we're trying to impact the same things. We use completely different vocabularies, but it's the exact same thing. So understanding and getting to know across the perspective and spectrum of people that may impact the same issues in a community. And when you get to really basic issues in a community and need, things like transportation, which always get in the way of healthcare, you got to bring in the transportation providers. You've got to talk to the community. You've got to talk to the government. And then she talks about the most effective partnership she ever had, which was the local health system, local lay people, health champions, county health, school admin, area mental health, and an outside regional funder. Be creative. Creative solutions are the best. I think telehealth is one of the most creative solutions out there. Think beyond the traditional thinking approaches. One of the things that I'm talking about a lot in the school-based program is we want to change everything, because what we have isn't working for many, many kids. So we have to change the environment, because we have to create a situation where every child has the exact same opportunity for success in life. Understand each other's terms, right? With school districts, I had to learn that they talk about Maslow's hierarchy of needs. We talk about social determinants. I mean, there's so many languages that are saying the same things, that are related to the same things. And anybody who's worked in healthcare for even a short period of time knows that we cycle through things too, right? We talk about social determinants of health. Anyway, I could go on and on about just the terms I've lived through in my 20 years in healthcare. So my thoughts about local partnership: trust, respect, communication. Talking to each other, the earlier the better, right? When that grant is due next week, it's not the time to ask somebody to be a partner. It's not the time to learn who each other are. Cast a wide net. I think most programs and most services, the wider the net, the more successful they're going to be, but also the most impact they're going to have. Understand your community's needs. Really think about your needs assessment. If you're a hospital, don't just do a needs assessment because you're required to. Do a needs assessment because you want to understand what the community needs. And I have seen so many hospital needs assessments that list 5 things. The community says we need substance use treatment, we need prevention, we need social determinant related stuff, we need transportation. And then the 5th thing was we need another oncologist. And the hospital will just pass right by the first 4, right? That's not our sweet spot. But we're gonna add an oncologist. you really have to think about, well, what do we do, especially as a nonprofit entity in a community? And the community is telling us these are the needs that impact their health. How do we become part of it? And this can be a little bit scary. I worked with a school district in Missouri that saw that what they really needed was a teen homeless shelter. School districts don't want to jump into teen homeless shelters. School districts don't often want to jump into, or they're scared of doing behavioral health and having therapists in schools, that it can really change everything if it's done in the right way. I can tell you, I've never had a community push back against having therapy in schools, but it's how you do it. It's empower parents and things like that. Be honest, acknowledge mistakes, be mutually accountable, right? We have this grant together and we're going to work on this thing together. So talking about state and regional partnerships, when I was a government official, right, so I oversaw all these programs, National Service Corps, state loan repayment, underserved areas. So I was that government person trying to get healthcare where it was needed in the state. And then as a local entity, right, I had to CEO of a federally qualified health center. Had to work with foundations, state agencies and boards, and universities and state associations and interest groups in the legislature. And your telehealth program is going to be more successful if you have some of these partners in place. I would tell you to consider partnering with agencies and boards, your state rural health office, your primary care office, if you're a federally qualified health center, or work with them. Associations can help you out. Rural health associations, the hospital association, the primary care association, primary care office, of course, National Service Corps, state loan repayment, and other things you may need help with. Universities can be strong partners if they kind of don't forget that they're part of our community and part of the state and don't know better than you. They know, right? They may have resources and expertise, but you know what the needs are. And as long as that's coordinated and working well together, it works great. Foundations, there are both regional and statewide ones that focus on your area and your region. We have a lot of conversion foundations in our 3 states, and they have to, that money has to go to healthcare and it has to go to improving the health of communities. So know your foundations, especially your conversion foundations or your foundations that focus on your area. And then why should you partner with them? Well, first of all, they can help you get the money to start these programs and get them sustainable. They can provide technical assistance and they can link you to others. And that, I used to think my biggest job as primary care director in the state of Kansas was somebody telling me a problem and me saying, have you ever talked to this person over there? Because they're doing this thing and they've seen some success. And I used to want to get some funding so I could send directors of one healthcare entity to go spend a week at another healthcare entity to learn from each other, because I often found the most innovative and successful stuff was already being done. And it was just, how do I help people know and hear somebody who's thought of an innovative solution that's been successful for this. Looking at some state and regional partners, and especially thinking about foundations and what they look for. Liz Lacey, who's a member of the board of the Sunflower Foundation in Kansas, support for local partner at the state or regional level to talk about what's going to give the most impact for funding, documented numbers, collect, track, and trend data, right? Information. If you don't participate and talk to local and your state partners, then you're not part of what they're planning and where the money's going for your state. Participate consistently at the state level. I know you may think you're busy and you can't do these things, but if you're not part of the conversation at the state level, if you're not known, then you're not going to be part of the solutions. And now there'll be negotiations. So Kim Moore, who had a very long and successful career focusing on rural health in Kansas, as president of the United Methodist Health Ministry 5, said it's important to, with their funders, to agree on goals and expectations, communicate, functional learning communities where you're learning, right? One of the things that I think we do is we write a grant and then it's not successful, it's not working. And we're afraid to go back to the people who funded it and say to them, hey, it's not working, but we want to try this other thing. I've even had this conversation with progressive project officers, and they will tell you they can let you modify your funded grant. They want to see it be successful. So be honest and be open and tell them the truth, and they can help you. Appropriately assign the roles for participants. That it's important that you have organizational leadership, strong organizational leadership, and when you're planning for things, have not only those that are leading the organization that are going to say, yeah, our organization will do this, but the people that are actually going to have to do the work and see if they have the buy-in. Our work in Southeast Kansas, so much of that is about not Craig Carell, who's the superintendent in Coffeyville, but Alexis McMillan, who's the person that has to work with the community health workers and get them hired and work on social services and special needs. They both have to be at the table. Talking on the Missouri side, luckily Jessie LaRose was nice enough from the Missouri Foundation for Health to talk about it. She did a presentation where she talked about partnering between foundations and local people, and she called it a dating, and I think these are great. Dating tip 1, when you're talking about foundations and funders, know them. Dating tip 2, do the research. What do they want to work on? Understand them. Dating 3, make the introduction. It's one of the things I do a lot with people, and I've done it even with the Heartland Health Resource Center, is say, here's the funder who doesn't know who you exist, but will be very interested in your work. And I've literally read through people's letters. Don't ask for money. Don't say, I'm writing you because I need your money. Say, I'm writing you because you work on this issue, and I think what we're doing is very interesting, and I'd like to talk with you about it and have you visit or have a meeting, a conversation where we talk about it, because it's their job to know what's going on in their funding areas. It's their job to know who's working on these areas. They welcome that, and they will literally meet with you. But don't start it by saying, I need your money. Start it by saying, you need to know what I'm doing because it's so amazing. So definitely reach out to them, not necessarily. And it's just like the time to partner is not when you're asking somebody to be a partner, right? It's not when you're asking somebody to join your grant. The time to know a foundation is not when you're asking them for money, because you're not going to go to the top of the pile when they've never even heard of you. You may have the most innovative idea ever, but unless they believe you have the ability and knowledge and experience to do it, they're not going to give you the money. They can't. And then again and again and again, well, be your own matchmaker, right? Need, solution, mission, and then strong communication, right? You cannot communicate enough. And this is really great. Jessie was nice to give this to me. This is her matrix of proposals when you think about funding. So you can see you got great idea, poor presentation, doesn't get funding. Great idea, great presentation, that gets funding. Poor idea, poor presentation, poor idea, great presentation. So only that top right corner is what a foundation is going to fund. But it's really interesting to think about. And as you think about a proposal, do I have a great idea and a great presentation? Sheldon Weisgrau, who used to be and had the hard job of trying to get Medicaid expansion in Kansas, which we still don't have, but it wasn't because Sheldon didn't do a great job. It's other things, but also is now VP for Health Policy at the Missouri Foundation for Health. Said it's important to understand that rural areas aren't monolithic, variety of viewpoints and agendas, and you got to get them all in the same room, or you won't have community buy-in, or they may be the end of your partnership or an endeavor because they stand in the way of it, right? If you're threatening a local hospital, how do you talk with them and understand how to be complementary versus, combative? Understand the benefits for community, get to know your funders and foundations again and again and again. Introduce yourself both in the community and at the state and regional level. This really again and again and again comes back to these things: trust, preparation, collaboration, communication, and shared values and goals. Talking about national and federal partners, I would tell you to do it. First of all, there's a lot of money out there. There's a lot of interest, and we've got to get healthcare fixed in this country. And there's a lot of initiatives to do that. So who you should talk to when you're talking about telehealth and you're talking about your work. Office of Rural Health Policy. If you've never looked at Rural Health Network grants, if you've never looked at substance use network grants, you're missing out. Office of Rural Health Policy has amazing grants. They're on a cycle, so they're always coming back around. I actually often review for the Office of Rural Health Policy. There are a lot of good ideas out there, a lot of poorly written grants, I'll tell you as a reviewer. And it's often because they haven't done that local community work, and it's clear. This last go round of Rural Health Network planning grants was the first go round that I've been aware of where an urban partner could apply for it. And the biggest thing I saw was state offices of rural health, big academic institutions, and they didn't mention their local partner once in the grant. And I'm like, this is a rural health network, where's the rural? And that's just, it showed that they hadn't done the work. Office for Advancement Telehealth, right? We currently have a number of grants from them, including the Health Resource Center for Primary Healthcare has for health professions. There's a lot of good national agencies to work with, SAMHSA, of course, if you're in behavioral health or substance use. Associations, right? National associations like the National Association of Community Health Centers, the National Rural Health Association, technical assistance you can get from that, the Rural Health Resource Center or others. And why national and federal partners? Same thing as state and regional. They're there to provide technical assistance and to fund your efforts. And they, I say this over and over. We think of ourselves as going to a national partner or going to a foundation and saying, I need something from you, or we feel like we're beggars at the door. They need you as much as you need them. They're trying to impact health, and their job is to know what's going on and to be part of innovative solutions. So don't think of them as someone who's just putting up or that you're annoying by talking to. They need to talk to you. They need to be your friend. And then if you get funding from the feds, don't treat it as adversarial. Don't treat it as I'm going to hide, or they are a problem, or they could be a problem. Anybody who sits in a project officer call with me knows that I go on and on about everything, probably way too much, just like I'm doing today. But they know me, they know what we're up to, they know our passion, they know what's happening. And we have very successful grants with the feds, and we have a very high opinion from the feds, including, unfortunately for me, constantly being asked to present nationally on things like partnership and this work that we're doing, because they see the engagement, but they also see that what we're doing works at the local level and that we have results from the work that we do. So talking to Michelle Carnes, who is the project officer actually for the Heartland Telehealth Resource Center. So asking about what's important when you do national and federal partnerships. Remember that the areas with the most need are often those with the least access. So it's something you can do to help with access. Reach out to organizations who've done something, find out what they've learned, and they can help you. People at the federal level can help you, help you to somebody else. You can often get copies. We're writing a grant right now. One of the things we did was to go see what Missouri's application looks like, go see what Oklahoma's application, because they're already funded by this program. Start small, help bring your partners along, conversation, understand the readiness of your community. Sarah Faye, who was often my project officer when I had local network funding, said, understand the community, help, how is this money that you're asking for from the feds going to fit the pieces together to achieve the community and national goals. And then Melinda Baldwin from SAMHSA, I wanted to get a nice diversity. So we got Office for Advancement of Telehealth, Office of Health Policy, SAMHSA, and they were very kind to talk to me and allow me to put this on paper and pretend to say what they said. Hopefully it's close, or at least not against what they said. Here again, Melinda Baldwin, Director of Prevention, Traumatic Stress and Special Programs for SAMHSA says, and as well as Evelina Taran, who's our project officer for the SAMHSA grant we currently have, communicate, get to know your partners, collect and disseminate honest data, right? Both about the problem and about your achievements. Let's look at barriers, listen, and make sure everybody part of that partnership has skin in the game. And the way to get there is for you to understand what they want, right? The biggest thing about partnership is hearing what they say the needs are, hearing what you say the needs are, hearing what they want to do, hearing what you want to do, and find a common ground. So right back to the same core concepts. And if you got nothing else, hopefully you at least saw some pretty bunnies today. So thinking about telehealth and financial sustainability and support, and that totally ties into a conversation on partnership, on community engagement, and everything else, because this is how you get financial sustainability, because if you get buy-in, people participate, they get the services, they get the care, and you get the money, to be really blunt about it. So I'd say consider grant funds for planning and startup. You can always provide some technical assistance, certainly can provide TA related to where other resources with funds related to the type of work you want to do that's billable. Understand what you can do sustainably off billing. Look at value-based models and payment mechanisms, right? That's where healthcare is going. And think about cost savings, right? If we do this, community health workers save money. We saw that in Missouri, right? So Missouri Medicaid funded a pilot project and saw such great success. Health homes in Missouri, another great example, right? By investing more upfront and managing and partnering with your patients, you save money for the insurers, and then they're willing to pay for these types of things that you're like, I wish somebody would pay for me, a staff member who can work with patients directly. Somebody will, if you save them money, and you will save them money. So we look at resources, think about your internal ones, what are community agencies and other resources that may be available in the community, what are other outside ongoing resources that you can leverage funding, go to the foundations, go to HRSA, go to SAMHSA, pay attention to grants.gov, the best place to understand what the grants are that are out there. When you talk about broadband and fiber and other things, obviously the USDA, USAC, those are important. And then finally, getting back to how do you engage your patients in telehealth, it's the same thing as any other partnership, and your patients are the partner. So unfortunately, at least this one, I think is the cutest one, the Fluffy White one. But treat your patients as equal, treat them with respect, be prepared, understand what they need, collaborate. You should be collaborating with your patients. That's what healthcare is being. Communicate. Make it easy to communicate with you. Where I get my healthcare, I have to go through a gatekeeper that isn't my family practice clinic to even get to my family practice clinic. And they say that's because they want to collect my demographics. But they collect my demographics, and as soon as I get into family medicine, what's the first thing they do? They recollect my demographics. So I don't understand why I have to see a gatekeeper. Why can't I call family medicine? But that's a little personal issue between me and my healthcare provider. Communication, shared values and goals, right? We should all want that patient to be healthier, but we need to help and understand what's important to them to be healthier and what's important about their health. So why partner? Wherever it is, right? You're not alone. You can't do it alone. You're not going to impact the community. You're not going to be a valued part of the community if you're just off doing it alone and think you have all the answers. You have all the others, you engage others. So getting back to the end, what matters? Trust, respect, communication, conversation, knowing each other, broadening, excuse me, broadening who you engage. Libraries are a great place for telehealth, and they're a great partner in training and communication and education. Know your community's needs, be part of your community, pay attention to what's needed, pay attention to what people are saying are the needs. Don't ignore what the community feedback is and go with the thing you wanted. Listen to what they say and reconsider what you're going to do. Everybody wins. You can partner locally and come up with solutions that everybody has a strong basis in, everybody has a strong partnership in. Know what the community needs and build your programs around those needs rather than saying, I'm going to do this because I think it's a cool thing. Maybe the community doesn't want that or need that, or it's not going to be a sell in your community. Be honest, acknowledge your mistakes, be open with whoever you work with, including your patients. And that is everything I have. I know I have talked about a lot and certainly have included a lot of information, but hopefully you found it useful. The thing to know is from that patient all the way up to the feds, it's the same stuff that's going to lead to strong programs, strong partnership, and success. So do we have any questions? Does anybody think anything I said is wrong? I'm really interested in your feedback on what do you think is important about partnership? Am I off base anywhere? I can take it.
I'll jump in with a question, Robert. I really liked your analogy with dating and engagement, and the same kinds of respect and trust things. I wondered if you had guidance or folks on the ECHO had guidance, when a miscommunication happens or a mistake, we talked about that with communication that's bound to happen. How do you approach that?
Well, and first of all, thank Jessie LaRose with the Missouri Foundation for Health because I stole the dating tips from her. And I do like that idea of dating tips, especially. And that's about dating your foundation. But it is interesting because I think if you don't know what to do, think what you would do in a personal relationship, right? If I had a friend and we had a miscommunication, or I actually even did something that harmed them, right? You can accidentally do those things or intentionally, I guess. What would you do in that situation? And it's the same thing in partnerships. Trust is crucial. I would say the biggest reason why I can call people from 20 years ago and they'll still say, yeah, let's get in this, right? And sometimes they're crazy ideas, that haven't been tried before. It's because they trust me. And they know that I've screwed up. There's not one of them that I've done everything right with. There's not one program I've ever run that's been perfect. But they also know that I'll keep working at it and I'll keep working with them and I'll keep listening to them and we'll get past it and we'll come up with a better solution. One of my favorite things to say, because so much of the time you're doing something that's new and hasn't been tried before and you don't know how to make it work, is we'll try this till we figure out what does work. And as long as you're in that sort of conversation where you're figuring it out together and you're not promising more than you know, and it's okay to make mistakes because you start from a place of saying, I don't have all the answers and I'm not implementing this to you, I'm implementing it with you. And I know we say it with versus to a lot, but I don't think many of us get that. That giving up control is the hardest part. And sometimes, especially when you get a grant, you want to say, I got this grant. This is my grant, and you're my partner. Giving up complete, for us, KU Med, if we don't give up control to those local communities and say, you tell us what to do, you tell us what you need, I wouldn't work here. I'm not going to work for an organization that doesn't give all the power, and I think, it's the anarchist in me. I think patients should have the power over the provider. I think the smallest unit should be the ones who have the power. One thing we're doing with community health workers in schools or community health workers, period, is I want to fix the system. All the power is on the provider side, the healthcare provider. I want to put all the power on the patient side, because when we ask why our patients aren't engaged or our partners aren't engaged, and it's often because we're giving them no place to talk and they don't see any results from what they say. Sorry, I know I went on, and it's not about when you screw up, but those are just some of the things I think about. And I do truly mean it. I think patients will make good decisions. Like this paternalistic idea that we know what's better for our patients. We have a system that, right, it's not like I can choose. I don't have all the information, right? People go to school for many, many years to be a strong doctor, but how do we help get the information to them so that they're side by side with their doctor, getting information they need to make the best decision and empowered? That's something where community health workers or other types of community-based interventions, care managers, I think are crucial. We wonder why our patients aren't healthier, but we don't give them the resources to be healthy, and we don't listen to what they say is the priority.
Robert, I just want to point something out. You had a statement in one of the last slides that said, introducing yourself when you're asking to partner. That's not the time to introduce yourself when you're asking to partner. And I thought that was a very important point, that we're all involved in this community work at some level with all sorts of projects. And then I think it's just part of what we've gotten used to. This funding opportunity pops in and it lists out partner ideas, and then you go reach out and say, hey, there's this money, and you haven't had the time to get to know what each other does. So I thought that was a very important and valuable point, that we can introduce ourselves at any time and get to know one another. And in many cases, go ahead and start partnering without this funding, because there's oftentimes that the programs overlap and we're doing some of the double work. So I thought that was a very good point.
And I just want to reiterate, because the biggest mistake I see in people who want foundation and national funding is they're scared of their funders. I am brutally honest. For example, I have a consumer-directed healthcare grant, and I spent quite a bit of time telling our project officer that I think consumer-directed is the wrong term and that we shouldn't be talking about consumer-directed, because that sees healthcare as a market, and healthcare is not a market. And if we're empowering people, we can't tie it to funding. We have to talk anyway. I can go on about that one too. Obviously, you can tell I can go on about anything, but it's okay to have arguments. It's okay to discuss things. I've told many foundations I don't like their priorities. I'll be honest, the Missouri Foundation for Health, when I first started doing school-based work, told me that what I was doing was too controversial and they wouldn't fund it. And 2 years later, they were asking for my advice as they were looking at hiring a staff member whose focus was going to be school-based behavioral health. When I started behavioral health in Missouri, the code 03 in schools wasn't open, right? The school-based code for behavioral health, you were not allowed to do behavioral health services in schools. Well, that's part of the change, and Medicaid changed that. Medicaid changed the idea. I said I can't do enough work in schools with just clinical social workers, and the FQHC, I can't bill licensed professional counselors. But they said, we like your work. I'll be honest, I was turned into Medicaid for committing Medicaid fraud, putting therapists in schools in Missouri. I was a community health center. We used Place of Service 50. I wasn't breaking the law, but it looked like we were, because, right, everybody said Place of Service 03 wasn't allowed. But that conversation and that preparation work and that conversation, making sure Medicaid knew what we were doing and understanding what was happening and having strong local partnerships. And to be honest, the Missouri School Board Association got behind the work that I was doing. Doing the right thing and changing things doesn't always mean you're not going to have adversaries. You are. But the work we were doing was so accepted at the local level, and also Medicaid understood what we were up to, And in response to that whole process, their response was, well, then we'll just change the rule and we'll open up behavioral health in schools to any type of provider. If you don't like what he's doing, we'll open it to everybody. And it's because I'd had these conversations, and because schools were saying, no, you can't take this away from us. I had strong partners. So when I had adversity, I had the people who understood why what I was doing needed to be done. And they were willing to even change the rules, even at a cost to Medicaid, right? And it's hard to change any policy that means more payments. But they so supported it. And they also saw that getting more behavioral health services to kids early was going to prevent hospitalizations, was going to prevent high cost needs. And making that case that getting early interventions is going to save Medicaid money, and showing that was the answer.
We do have a question in the chat, Robert. It's 2 parts, so I'll start with the first. Have you had any clients or patients that are still resistant to telehealth, telemedicine because they may not trust online visits?
And we haven't had that issue, and I've heard about it. And it's a rough one, right? And I don't know if there are other people in the meeting today that have kind of had these types of concerns and how they address them. Because I'll be really honest, I haven't seen that as a big issue for care, at least in our work. And it may be because we're working with kids, and also because that local partner is a school district, right? And so they're saying, hey, it's this partnership with the family, and schools are great partners in local communities, especially in rural communities, because they're trusted and they're often the central core of the community. And it may be because we're providing these services in partnership and collaboration with the schools, that we don't see that lack of trust.
Do we have anybody on the Echo today that could maybe provide a little insight to that question? Maybe this is something that we can find out over the course of our time through the HTRC, maybe get to know a little bit of that a little more and share it with you. The second part of the question was, how can we educate besides talking about HIPAA compliance and not confuse patients and clients more?
Well, and I think that gets into this idea of trust and the idea of, is my information going to be private? You can imagine. I'll tell you what I do with schools, right? Because there's this concern, right? Or when you think about putting a therapist into school, the question is, well, what's the school going to know? I don't want the school in my business, and traumatic things may come up. And so part of that is, for example, when we've started everywhere I go in schools, we talk about this as a partnership between the entity providing telehealth and the school district, right? So KU Med is providing these services, and the school's making them accessible if you want these services. Putting school clinics into Coffeyville was the same route, right? They've never had a school clinic before. There really weren't any in Kansas at that point. And it was a conversation of making sure that patients felt very much in control of their data, their information, and what happened. So with us, it meant parents feeling in control. With you, I think it needs to be the patient. And so talking about HIPAA compliance is one thing, but putting them and helping them see that they control their healthcare and that it's their decision, and just building up that sense of self-efficacy, sense of self-control, that I'm in charge of my healthcare, I think helps with that issue. But I think a lot of this comes back to being unknown, and that gets back to when you partner, make sure, when you go into a local community, get known in that community, be part of that community. I can tell you that it's probably easier for me to work in Coffeyville in Southeast Kansas now, because I used to live in Coffeyville. I lived there for 3 years. I ran a clinic there. I'm known. Get known in the community, get known by the people you're working with, get known by the patients. But I'll tell you, the other thing is, even if you have a clinic in a local community, if you're not out there walking around, one of the things, I go to a gym and there's some issues at the gym, and one of the things I see as a leadership issue is the staff sit behind a desk in a room that's behind the desk, and I never see them anywhere in the gym. So they're not known, and they're like, why is the morale so bad about this gym, and people aren't happy, and they keep saying negative things about the gym? Well, nobody knows them. They're not out, they're not around, they don't see what's happening. and people feel like things are out of control because nobody's running the place. So, these things about how businesses run or how you be known are pretty simple things. Get out there, be known, be part of people, do favors. So much of my job is people telling me problems that are not relevant or specific to what I'm partnering with them on, and pointing them in a direction of where to go or how to do it if I know it, or getting them the right person that can help them. Um, you can see it as transactional. I don't. I see it as being a true friend, right? Just because you're friends with someone about one thing doesn't mean if they have another issue, they can't bring it to you, and you can try to help if you can.
And if you check the chat, Evelyn beat me to it. We do have helpful videos and additional resources on the HTRC website. And there is a helpful video on helping the client or the patient prepare for their telehealth visit. There's also some helpful resources on health literacy and just different things that can be used to share with your patients in helping them prepare for their visit. And also you can reach out to us directly, and I'll put our email address in the chat as well if you have additional questions after you visit the website.
I might chime in. I think sometimes we just say out loud, give us a test drive, see if it's a fit or not a fit, and then you make the choice.
And I just want to, I know we're almost done, and please, if other people have questions, but the final thing I want to tell you is I don't know anything. And when asked to do this partnership presentation a long time ago, I went and asked the partners. I'm not perfect or great at this. Sometimes I think it's because I'm simple. Maybe in the head, as my mother would say. She's a rural Ozarkian who uses things like simple in the head. But I guess, I feel fortunate that the people who worked with me continue to work with me, and that I can call people from 20 years ago. There's almost no one that I've ever worked with that if we had a new idea that involved them wouldn't be interested in at least hearing what it is. And, have good ideas, maybe, hopefully, or help develop good ideas or listen to their good ideas. But the second thing is, understand that it's an equal relationship and value their input as much as you value your own.
Thank you, Robert. I also maybe would add that based off of all this great information that was shared today, I would encourage everyone on the call to maybe rethink some of their local partners. And if you haven't reached out, maybe now's a good time to do that and just say hi and let them know what you're up to, what some of the projects are you might be working on, maybe what interests you have in adding some new, maybe innovative things, maybe possibly related to telehealth, and some things that you can provide in the community, and look at your partner list. I do love that Robert talked about libraries. They are wonderful partners. They provide so many services to communities across the board, and sometimes they host projects and programs and all sorts of different things. So I liked that shout out to libraries as well. Does anybody have any last questions or comments?
I was going to say that at FCC Behavioral Health, we have the behavioral health in the school systems, and it was a challenge to get that started because everybody was kind of skeptical. They didn't want us in their space and everything else. But once we kind of started and had some successes, it's gone over wonderfully. And we've actually partnered with some schools that would never even let us near their schools before. But one of the key things I think we did is we hired a retired principal or superintendent, I think, in the area that had all the connections. And he is our liaison between our schools and our clinical staff. And that made a huge difference because that relationship was already there. And I think that was a huge step in the right direction for us to be very successful in the school systems.
I totally agree with that. The other thing I would add when it comes to schools, if you're interested in schools, is understand that schools are there to educate children. So behavioral health in schools, community health workers in schools, they have to understand how this allows them to educate. When I went to Coffeyville, right, the question I got from teachers is, you're going to pull these kids to a medical appointment and they needed to be in the classroom learning. But what they had to learn was and see that this child that had this medical issue that was keeping them from learning, and therapists in school is a perfect example, because that child's behavioral issues are impacting their ability to learn, but they're impacting every other child in that classroom's ability to learn, because that behavior is keeping the teacher from teaching. A community health worker that works on social determinants means that the teacher's now not having to be responsible for does that kid have lunch money? Does that kid have clothes to wear? So yeah, I may take the kid 1 day a week for therapy, but the behavior improves and that child is learning. But even more importantly, the teacher can now focus on the whole classroom. I come from a family of teachers. So first thing I always tell people is if I get it wrong, I've got to answer my family, and especially my mother who taught for 58 years. But the second part of that is understanding a teacher's perspective, and that as soon as they see the classroom change, because they have that kid that's taking all their time and they feel for that kid. But what you often find is that child gets alienated from the rest of the classroom because the other kids get tired of the behavior, they get tired of what's happening, they get tired of not being able to learn, and the conversation becomes adversarial, and kids aren't learning. But if you're going to go into schools or you're going to go into any type of environment, understand the environment and what their goals are. And absolutely therapists belong in schools. And you're not impacting learning, you're adding to the ability to learn. But you have to recognize the goal of that school is to a successful child. That's why we talk about successful children in communities, because that's a kid. Schools are told to take this child with all these things going on at home, all these things in their background, all these things going on, and educate them and make them a success, right? Prepare them for life success. So we can be a partner and add to that life success and meet the healthcare goals, but also meet the educational goals, which is the only reason you should ever be in schools, is to help them educate children.
We do try to stay away from the core classes in most of the schools and try to work around that so that the kids are in those core classes and not pulled out during that time.
I don't always take a kid, you know, I've seen programs where they're like, well, this kid comes at lunch because that's the only time the teacher says, no, don't take the fun away either. Move it around, right? And that's a hard part, right? Because therapists want to do 11 o'clock every week, I'm going to see Johnny. But 11 o'clock every week, Johnny's missing something. So when I had therapists in schools, like I would ask them to really try and consult with the teacher, say, hey, I need to pull Johnny. When's the best time? But also help the teacher see that Johnny needs to go to art and recess and everything else. So try to find times where you're having the least impact. Stay away from state testing. You just probably don't get to do therapy in April, or at least those 2 weeks, because it's just not going to happen. So anyway, sorry, I can go on and on about school health because that's what I spent the last decade of my life on, and I believe in it. I 100% believe in it, and it's what I'm going to spend the rest of my career doing.
Thank you very much, Robert, for your presentation. We have just a couple minutes left. I will remind everyone, we will be sending out the presentation along with a survey to gain input from your experience today. Be sure to join us again on May 10th, and we will be covering telehealth processes, more specifically the clinical flow. Beth, did I forget anything?
No, you got it all. Thank you so much.
Also, remember, if you have any questions afterwards, you think of something, please don't hesitate to email us at htrc@kumc.edu. I put it in the chat. And if you have questions specific to your area or your state, we will definitely forward it on to our experts in those areas. So thank you for your time today, and we will see you on May 10th.